Good morning and aloha. My name is John Mizuno. I'm chairing the Health Committee. It's Tuesday, February 7th. It's a little after 8:30 a.m. We're at the State Capitol Conference Room 329. Going to ask for the testifiers' kind indulgence. Going to go around the room and have our committee members identify themselves for you, starting with Representative Garcia.
Aloha, I'm Diamond Garcia, representative of District 42, Kapolei, Ho'opili, and Eva.
Good morning, everybody. Ajana Takaneuchi, House District 27.
Good morning. I'm Representative Teresa Amato, Vice Chair, representing South Maui, Kihei, Wailea, and Makena.
Thank you.
Bert Kobayashi, representing 20th District, all around Diamond Head.
Okay, thank you, members. First up, we've got House Bill 224, House Draft 1. First testifier, Department of Human Services, Hawaii Public Housing Authority. Good morning, Hakeem.
Good morning, Chair, Vice Chair, members of the committee. Hakeem Wansafi, Executive Director, HPHA. We stand in strong support of this measure. Thank you very much for hearing it.
Thank you very much.
Thank you.
Okay. I don't see any other testifiers. Is anyone else, either on Zoom or here present, would like to testify on House Bill 224, House Draft 1? If not, members, are there any questions? No questions? Okay, thank you. We're going to move on to the next measure. This is House Bill 507. First up, we've got Kathy Betts, Department of Human Services.
Good morning, Chair Mizuno, Vice Chair Amato, and members. My name is Scott Morishige. I'm the Administrator for the Benefit, Employment, and Support Services Division on behalf of DHS and our Director, Kathy Betts. The Department appreciates the intent of this measure and offers comments. In our testimony, we note that federal regulations actually require retailers to accept payment as long as an EBT customer has a valid PIN. This is regardless of whether the state requires a name on the EBT card or not. Even if the name of the individual doesn't match the name of the card, retailers are still required to accept payment. I'll stand on the remainder of our testimony and I'm available for any questions. Thank you.
Okay, thank you very much. Next up, we've got Hawaii Primary Care Association. Provided testimony in opposition. I've got three individuals. One provided testimony in opposition, one provided comments, one's provided support. If anyone here wishing to testify either in person or on Zoom, please let us know. Okay, if not, members, questions for House Bill 507. Yes, Representative Garcia, followed by Representative Amato.
For Mr. Morishige, thank you for the comments on the federal provisions. What is the department doing currently to mitigate the high amount of fraud through the SNAP program? Because I personally was raised in public housing and saw this firsthand all the time where folks get, there's 4 kids in the family, they get $3,000 a month in food stamps, and they sell a good portion of that for cash. And at the end of the month, the kids go hungry. So what are some ways that the department is currently doing to mitigate those abuse of benefits?
Oh, thank you for the question, Representative. So we have, an investigations office that investigates these types of complaints. They receive complaints from the general public through our fraud hotline, so 587-8444. We also have our EBT program staff manage EBT card payments to see if there's fluctuations, that if they notice anything unusual, they can refer to the investigations office for further follow-up. Well, those are some of the steps that we're taking to prevent fraud, and something the department takes very seriously.
Thank you.
Mr. Morishige, is there any evidence that indicates matching a name on an EBT card with a driver's ID or something reduces the likelihood of false use of someone's card?
I think thank you again for the question, Vice Chair. The key point, I think, is that the federal regulations right now actually would prohibit retailers from requiring that. So even if this were to pass, it couldn't be implemented without the retailers violating the law. So that's something that would have to change at the federal level.
Thank you.
Thank you. Further questions, members? Okay, if there's no further questions, we're going to move on to the next bill on the agenda, House Bill 1437. 1437, first up, Office of the Public Defender. Provided testimony in opposition. Next up, Attorney General's Office. Good morning.
Good morning, Chair Mizuno, Vice Chair Amato, members of the committee. I'm Alan Komogomi, Office of the Public Defender. So we were confused. We opposed two parts of this bill having to do with the mandatory penalties, that being the $200,000 minimum fine, and what we read as a mandatory minimum sentence. But in talking to the two members from the Attorney General's office, it appears the sentencing is a mandatory minimum sentence where I guess they're asking the court to go anywhere from 0 to 20. So if that being the case, if it's not a proposal for offender to serve 20 out of 20, then you can probably disregard most of our written testimony. And just addressing the mandatory minimum, I think the language needs to be clarified, and it needs to state not definite term of imprisonment. It needs to state a mandatory minimum from anywhere from 0 to 20 or anywhere up to 20 years. So I think their language needs to be clarified there so there's no confusion. But we would still oppose the imposition of a mandatory minimum term because as it stands now, this offense is a Class A felony and a person is going to be sent to prison, no probation. And that person still has to go before the Hawaii Paroling Authority, and the Paroling Authority is going to set a minimum anyway. So it's like we're making double work. The court's going to have to set a mandatory minimum, and then the parole board's going to have to do the same thing. So we'd prefer just the law to stay as is because that person is still going to have a minimum setting anyway. And we're opposing the fine. You know, we believe the fine violates the U.S. Constitution and the Hawaii State Constitution in that it's an excessive fine of $200,000 minimum, and that it doesn't consider the offender's financial circumstances and their ability to pay. And clearly, someone serving a 20-year prison term is not going to be able to come close to paying a $200,000 fine. So for those reasons, we oppose this bill. And thank you for the opportunity to testify. I'm available for questions.
Thank you very much. Next up, we've got the Attorney General's Office.
Good morning, Chair Mizuno and members of the committee. My name is Leo Kimoto, Deputy Attorney General for the state of Hawaii. The Department of the Attorney General offers its comments on the bill and recommends against any changes being made to the sex trafficking statute, as the department has recently charged a criminal case under this statute for the first time since its change in 2021. The sentencing measures that are already in place for Class A felonies is untested with regard to this statute, and increasing the fine and imposing a possible mandatory minimum sentence are premature at this time. Additionally, the department has concerns with regard to allowing persons to avoid criminal liability by reporting that they have been trafficked due to there being a lack of definition as to what constitutes the reporting, as well as there also being possible unintended consequences of false reporting. Finally, the department is concerned about the proposed additions to the Section 712-1207, as the department does believe that the additions will lead to confusion. Thank you. I'm available for questions.
Yes, thank you very much. Thank you very much. Okay, members, I've got 7 individuals all testifying in support. So if you're here and would like to testify, please come on up if you're here in person or if you're on Zoom. Again, we are on House Bill 1437. Okay, if not, members, are there any questions? Seeing none, I had one for the Attorney General's office. I need a clarification. I'm looking at page 3, lines 14 to 16, wording which may actually indicate that the perpetrator, that I guess this would be targeted at the pimp, could get a release of criminal liability by arguing that he or she is a victim of sex trafficking. Is that correct?
I'm sorry, page 3 of our testimony?
Of the bill.
Oh, of the bill.
Page 3, lines 14 through 16.
I think that is a possible consequence of changing that language or adding that language to the statute.
Yeah, we saw that too, and we thought that that could get the perpetrator a release of criminal liability just by claiming that he's a victim of trafficking.
Yes.
Okay, we're in agreement.
Thank you.
Is there anything else really noteworthy to point out? Because, if we move this bill, there's a lot of cleanups, a lot of amendments we need to do.
I think the testimony that we have submitted does encompass the concerns that we do have.
Okay.
Thank you.
Okay, thank you very much. Thank you. Members, questions? Okay, if not, we're going to move on to the last bill of this 8:30 agenda, House Bill 438. 438, first up, we've got Department of Human Services. Okay, DHS, Kathy Betts provided comments. Next up, Office of Youth Services.
Good morning, Chair, Vice Chair,
Good
members of the
morning.
committee. My name is Leanne Gillespie. I'm the Executive Director for the Office of Youth Services. We'll stand on our written testimony in support, but I'd like to draw your attention to HB 456 that is set for hearing on Thursday morning. It looks like both bills have a similar intent. In terms of providing more services and coordination for youth that are overrepresented in our juvenile justice system, and that maybe you would like to look at combining the two. But thank you very much for the opportunity to comment.
Thank you very much. Okay, Opportunity Youth Action Hawaii provided testimony in support. Filipinos for Affirmative Action. Testimony in support. Hawaii Coalition for Immigrant Rights. Testimony in support. Hawaii Friends of Civil Rights. Testimony in support, and I've got 4 individuals all providing testimony in support. If anyone is present or on Zoom wishing to testify, please come on up. Again, this is on House Bill 438. Seeing none, members.
Chair?
I'm
Oops,
sorry.
sorry.
Hi.
Sorry, Chair. Vice Chairs of the Members Committee, just doing daycare drop-off. Liza Ryan Gill with the Hawaii Coalition for Immigrant Rights, and we just wanted to stand on our testimony in strong support. You know, we have been working with the Department of Education and other members of the COFA community to address the 50% dropout rate amongst our Micronesian youth in our education system. And we believe that these are structural barriers that require a systemic and sustained state effort to address them. So we just urge the committee to consider this and move it forward. Appreciate it.
Thank you for your testimony. Anyone else wishing to testify on House Bill 438? Seeing none, members, questions? Okay, if there are no questions, we are going to recess and come back for decision making. We've got a joint hearing coming right up, but we're going to reconvene for decision making 11:30 a.m. today in this room. Recess. Good morning, aloha, welcome to your state capitol. Tuesday, February 7th, it's a little after 8:45 a.m. We're in conference room 329. If I could just note the presence of Chair Bellotti of the Health Committee. We're going to start off with the first bill on the agenda, House Bill 883. First up, Department of Human Services.
Good morning. On behalf of the Department of Services, I would stand on that written testimony.
Thank you, Dr. Moore Peterson. Okay, next up, we've got the Department of Health. Department of Health.
Good morning, Mr. Chair. Department of Health stands on its written testimony.
Thank you very much. Appreciate it, thank you. And next up, Hawaii Substance Abuse Coalition. Alan Johnson, are you here? Alan Johnson? Provided testimony in support. That's all I have on the testifiers list. Are there anyone else? Is there anyone else in the audience or on Zoom wishing to testify on House Bill 883? Okay, if not, members, questions on 883? No questions, thank you. We're going to move on to the next bill. Next bill on the agenda is House Bill 916, calling State Council on Developmental Disabilities. Thank you. Good to see you. Thank you, Doctor. Next up, Hawaii Autism Foundation. Provided testimony in support. Hawaii Self-Advocacy Advisory Council. Provided testimony in support. Chair notes that we have 6 other individuals providing testimony, all in support. So if there's anyone here wishing to testify on House Bill 916 or on Zoom, please let us know. Come up and state your name and we'll listen to your testimony.
Good morning.
Good morning.
Chair members, Bayati, and council members and community members. My name is Kari Swan. I'm in support of this measure because $50 a month is not enough to go out with my friend. Thank you so much, and let me know if you have any questions.
Okay, thank you very much. Thank you. Yes, Dr. Judy Moore Peterson.
Good morning. I apologize, but Department of Human Services did submit testimony. I just wanted to make sure if you did not have it, we submitted testimony in support.
Oh, I apologize.
And offered an amendment.
Yeah, Dr. Moore Peterson, I apologize. Yes, DHS did submit testimony. Okay, with comments. Thank you. Thank you very much. Okay, now I believe I've covered everyone. Is there anyone that I missed who would like to testify on House Bill 916? Okay, if not, members, are there any questions on 916? Seeing none, we're going to move on to the next bill on the agenda. This will be House Bill 1053. First up, Office of the Governor. Office of the Governor, we stand on everything and show. Good to see you, Majority Leader. Long time no see. Thank you, Blake. Appreciate it. Okay, guys, we're still on 1053. Next up, I've got Judiciary. Judiciary provided comments. Next up, we've got Department of Human Services.
Well, DHS stands on our written testimony and would defer to Department of Health. Thank you.
Okay, thank you very much. Office of Wellness. Next up, Office of Wellness.
Morning, Chair, Vice Chairs, Office of Wellness and Resilience, Executive Director Tia Hartsock, stand in testimony and strong support.
Strong support. Thank you very much. Next up, Executive Office on Early Learning.
Morning, Chairs, Vice Chairs, and Committee members. I'm Jordana with the Executive Office on Early Learning. We stand on our written testimony and support in the Department of Health.
Okay. Thank you very much. Next up, Hawaii Association for Infant Mental Health. Provided testimony in support. Hawaii Association for same organization. Domestic Violence Action Center. Provided testimony in support. Hawaii Children's Action Network speaks. Provided testimony in support. Epic Ohana. Testimony in support. Early Childhood Action Strategy. Testimony in support. And I have Department of Health listed here too. Oh, okay, Lauren. Okay. Thanks. Great to see you, Mr. Kim. Thank you very much. And I've got about 8 individuals all providing testimony in support. So if I've missed anyone, if anyone here present or on Zoom would like to testify on House Bill 1053, please come on up. 1053. Okay, oh, come on up, please.
Aloha kakakiaka. I'm Justina Acevedo Cross from the Hawaii Community Foundation, and we're in strong support of this bill. Stand on our written testimony. We've been helping to invest and build the system for infant early childhood mental health for the last 4 years, and we'd love to see it continued. Mahalo.
Thanks, Justina. And we do have your testimony. Thank you. Anyone else wishing to testify on House Bill 1053? Yes, come on up, please.
Good morning, Chair Mizuno and Chair Al-Baladi. I'm Carrie Rosevich, co-chair of Commit to Keiki Steering Committee. We stand on our written testimony and would like to add, in 2021, Surgeon General Murthy issued a rare warning and called to action to address the mental health crisis among our children and youth. Nationwide, we're seeing 25% increases in mental health doctor visits among kids ages 5 to 11, which are similar rates here in Hawaii. Children are increasingly experiencing depression, anxiety, and uncontrollable anger. We've seen these issues in our own families, our schools, and our communities, withdrawing and isolating, violence towards others, cutting or harming oneself, substance use, etc. You might be surprised to know that children under 5 have similar rates of mental health needs as older children, but are expressed through different behaviors. Approximately 29,000 keiki under 5 are in need of mental health supports in Hawaii. Supports need to be provided in a whole family approach by trained professionals. If we can provide supports when our keiki are young, we can prevent developmental delays and downstream mental health crises. Please move upstream by establishing the Infant and Early Childhood Mental Health Program in the Department of Health. Mahalo for committing to our keiki.
Carrie, thank you for your testimony. Okay, anyone else wishing to testify on House Bill 1053? Seeing none. Members, are there any questions? Representative Chair Bellotti.
I think this is for the governors. Representative.
Governors? Yes, yes.
Morning, Chair.
Morning. I'm very supportive of mental health generally, but I'm curious as to how this fits in to any other existing programs, or what is the vision for this?
So we currently have different funding and programs in various agencies within the state government. However, we don't have it all consolidated, and nor is there a singular strategy. And so the idea of this is to have one FTE person that would then kind of be the overall coordinator to work across the agencies, whether it's within Department of Health, whether it's in MedQuest, and also working with the nonprofit organizations out there, so we can build better synergies to really approach this. While we do have some programs in DOH that deal with infant physical health, we don't have too much that deals with mental health, and so that's the focus of this.
Okay. Thank you.
Okay, thank you, thank you. Yes, Representative Kobayashi.
For DOH, in your testimony, you're talking about $800,000. Prior testifier says there'll be one overall coordinator. So what does the rest of the $800,000 go to?
Yeah, thank you for the question, Rep. Kobayashi. My name is Lauren Kim. I'm the Policy Director for the Department of Health. There certainly needs to be a very focused effort on infant and early childhood mental health, and quite frankly, comprehensive children's health in general. So there is one FTE that would be the full-time coordinator working across government and the private sector. There are funds to match some of the philanthropy for Promising Minds from the Hawaii Community Foundation. And there are purchase of service contracts for consultants, for subspecialists, and for training of clinicians and program staff who work at the front lines. So the bulk of it would be purchase of service to kind of jumpstart where we need this program to go. We're still negotiating with stakeholders on what the structure of this program looks like. We all agree that there's a need, and so we do have a budget, a rough budget drafted as part of our justification sheet, and we ask that this measure move forward while we continue to determine what the program structure looks like.
Sometimes when we get a number like this, we don't know whether it's the high estimate or the low estimate. What does this number represent?
This represents a realistic estimate based on the resources that we know we have and that we know we don't have. I think it's easy to say that any investment in early childhood mental health is worth the price tag. As Dr. Yarosevich said, we need to move upstream. This is a bit uncharted territory for us. We know that it needs to get done. We need to move upstream. We need to coordinate with the Executive Office on Early Learning, the Lieutenant Governor's initiatives, and private stakeholders. But this does represent a figure that is, I guess, realistic in terms of being implementable for a new program to the Department of Health.
Thank you.
Question.
Yes, Chair Bellotti.
How does this build on anything that CAM-HD is already currently doing?
Child Adolescent Mental Health Division currently is an eligibility-based direct service program. Both adult mental health and child and adolescent mental health are actively discussing how they move upstream. For the past several decades, they've been focused on consent decree-related activities. And there's been a realization in the leadership in the past several years that we're not going to, quote, treat our way out of this. So it is in coordination with Child Adolescent Mental Health Division and Adult Mental Health Division that we're moving upstream. The current business model is direct services, and they are beginning to turn the corner into sort of into primary and secondary prevention of mental health, not only direct services at family guidance centers. So that conversation is happening. They are a part of this discussion. They are aware that this bill is moving, but they need time to pivot from their direct services model into one that is more prevention focused.
What are the purchase of service contracts that this plan is contemplating when you say that they're going to be lining up for purchase of service contracts?
Consultants that will do training. So there have been some trainings in the community that have taken place in early childhood and infant and early childhood mental health, addressing children's behavior challenges, screening and referral to treatment, and modifying programs and services to incorporate infant and early childhood mental health, as well as trauma-informed practices. So there have been activities in the community with regard to training. So we just want to formalize a structure around so that we can continue to provide this training. Quite frankly, the private sector has led the conversation in this, and the state is, I won't say playing catch-up, but I think really needs to take a more organized and focused approach to how we handle this systematically. And this is a good investment to start the conversation in the state government.
Okay.
Yes, Representative Kobayashi.
Sometimes when we establish a program by law, it takes a life of its own. The other way of doing it is to add $800,000 to the state budget with certain parameters, whatever, which could be very similar to this bill. Of course, the state budget has to pass. This bill has to go through a minimum probably of 5 committees, 3 here and 2 over there. So it might be more expeditious if you think of dual strategies.
Thank you for that suggestion. That is something that we hope that we can have that discussion through a governor's message on rolling this into a base budget. However, I think that the committee hearing process is a way to provide public input. Again, This bill is, I think, pretty solid in terms of the expenses needed or the investment needed. It's a little light on program structure, and that is something we need to work on, and we acknowledge that the program structure needs to be developed further than what is in the bill. And the committee hearing process, I think, is one of the best places to have that discussion, to make sure that we are not duplicating effort for, like I said, Executive Office on Early Learning, who has a very similar charge, and Office of Wellness and Resilience. There are many participants in this conversation, and we need to make sure that whatever is created makes sense and does not duplicate effort and work. So a base budget appropriation would be the ideal, so that it is recurring and it is a signal of the investment of the legislature in infant and early childhood mental health. And we hope to get to that point.
Thank you.
Yes, Chair Bellotti.
Question, sorry, Director or Deputy Director Judy Moore Peterson, since you're here for the Medicaid. I'm currently looking at the IECBH plan that's cited to in one of the pieces of testimony. I believe this is Hawaii's Integrated Infant and Early Childhood Behavioral Health Plan. First time I'm ever seeing this. It says in one of the short-term objectives that this group is going to work with Medicaid to develop a plan to reimburse for IED-MH services delivered by unlicensed IED-MH practitioners. Can you expand upon that? Because I believe that would be, I'm assuming that that's part of some of this program growth that we're talking about.
I think it's the long-term goal as far as just really expanding the people who could be engaged, broaden and expand the people who can be engaged in providing these very necessary and critical services from infancy. An example of an unlicensed caregiver or person and looking for ways to provide payment would be like a community health worker, as an example. There's other, we've been looking at programs across the country where sometimes preschool or daycare providers are provided training, and then Medicaid comes in and is able to support in some ways by providing services. Usually those have to be done through a waiver, but those are just a couple of examples of the kinds of services that we're hoping that we could be able to expand to.
Okay, so I'm assuming then, and maybe this is for Governor's representative, across departments you've been tapping people like Judy Moore Peterson, I don't know who the other leads are on this, to start to identify these?
That's correct. We have been involved. We have a person who's been very active in working with this group. We believe also, we do support the idea of having a more coordinated response within state government so that it's not just being led by the private sector, that we're all coming together and working together.
Okay, thank you. Thank you.
Okay.
Thank you, Chair.
Any further questions, members? Again, House Bill 1053. Okay, if not, thank you very much. We're going to move on to the next bill on the agenda, which would be 1343. First up, Department of Human Services, please.
Good morning, chairs, vice chairs, members of the committee, Joseph Campos, the deputy director, here on behalf of Director Betts. We stand on our written testimony, providing comments and referring to Commissioner's testimony. Thank you.
Okay, thank you. Thank you very much. Hawaii State Commission on the Status of Women.
Aloha chairs, this is Kara Jabola-Corollis. I want to first just thank the leadership of Chair Bellotti, who went above and beyond to address the crisis of forced pregnancy in Hawaii over the summer after the Dobbs decision. So thank you for working with the community so closely. And otherwise, I just want to stand on our testimony in strong support. Thank you all.
Thank you very much. Okay, next up we have the Hawaii State Coalition Against Domestic Violence. Provided testimony in support. Hawaii Children's Action Network speaks. Provided testimony in support. Imua Alliance. Provided testimony in support. Hawaii State Center for Nursing.
The Hawaii State Center for Nursing stands in our written testimony in support.
Thank you. ACOG, Hawaii section.
Aloha, Chair Bellotti, Chair Benzino, Vice Chairs, and committee members. Mahalo for hearing this important bill. My name is Rani Soon. I am a board-certified OBGYN representing the Hawaii section of the American College of Obstetricians and Gynecologists, or ACOG. You have our written testimony in strong support of HB 1343. I want to highlight a few things, not only as a representative of Hawaii ACOG, but also as one of only a handful of physicians providing abortions across the state. We have a serious lack of providers, a serious lack of abortion care on neighbor islands because we have a serious lack of providers. And the reasons for this are multifactorial, including the critical shortage of physicians in every specialty on neighbor islands. But I know that the legislature recognized this particular problem a couple of years ago by allowing, and tried to address it by allowing advanced practice registered nurses to perform abortions. I know of interested APRNs who have struggled to get the training, are struggling with getting malpractice insurance for this, other insurance kind of coverage, being able to get and dispense the medication. So the barriers and challenges they face have meant that this law has not been able to be actually operationalized on the ground and in our communities. We need someone to oversee on a statewide level what these challenges and barriers are and coordinate an overall strategy for getting more providers on neighbor islands. Many of these barriers, I think, can be overcome with a coordinated strategy. So while we greatly appreciate the legislature's efforts to protect our legal right to abortion, especially in light of recent national events, legality does not equal access, and everyone in Hawaii deserves access to this basic health care. Mahalo for this opportunity to testify.
Thank you for your testimony. Okay, next up, I've got Patsy T. Mink, PAC. Provided testimony in support, AAUW of Hawaii. Provided testimony in support. I've got 24 individuals providing testimony all in support and 5 individuals providing testimony in opposition. If any of the individuals are here today and either present here at the hearing or on Zoom and would like to orally present your testimony, please come on up and state your name. No one? Okay. Seeing no other testifiers, or if there's anyone else wishing to testify on 1343, please come on up. Seeing none, members, questions?
Chair on Zoom.
Oh, yes. Hi, Michael.
Hello, Chair. Yes. Hi, Michael Gloyu Jr. on behalf of the Stonewall Caucus of the Democratic Party of Hawaii. We stand in strong support of this bill. This law is long time overdue, especially with those fake pregnancy centers out there that are duping women and those that get pregnant into believing that they're actually medical health care centers. So we encourage you to pass this law to protect, to make sure that abortion rights are protected across the state. Mahalo.
Michael, I just want to make sure I get your written testimony for the record.
It's in record, sir.
Okay.
It's just late.
Okay, thank you. Anyone else wishing to testify, either present here at the hearing or on Zoom? Okay, seeing none, members, any questions? House Bill 1343. Okay, if not, thank you very much. We're going to move on to the next bill on the agenda. This will be House Bill 1368. First up, Department of Human Services.
Hi, good morning, Chair.
Good morning.
We stand our written testimony in strong support, and also would like to know that support and concur with the Healthcare Association of Hawaii amendment.
Yes, we got that. Thank you so much. Next up, Kaiser Permanente, Jonathan Ching.
Morning, Chairs. Jonathan Ching, I stand in support.
Okay, I saw you earlier, so I knew you were here. Hawaii Primary Care Association, Eric Abe. Okay, they provided testimony in support. Hawaii Pacific Health.
We'll stand in our testimony.
Thank you, Michael. Great seeing you again. Next up, we've got Queens Health System. Queens Health System.
Chair, we'll stand in strong support of this legislation.
Thanks, JC. Appreciate it. In strong support. And Healthcare Association of Hawaii.
Joseph Renthal, representing the Healthcare Association of Hawaii, standing in strong support and letting our suggested amendments meant to provide clarity that are non-substantive in nature. Thank you.
Thank you very much. And we did know that DHS does agree with your amendments, and they had some other minor amendments, so that will probably be my recommendation. Thank you. Is there anyone else wishing to testify on House Bill 1368? Either here or on Zoom. Okay, if not, members, are there any questions? House Bill 1368. No questions? Okay. Thank you very much, members. We're going to move on to the next bill on the agenda. This will be 1369 first up, Department of Taxation.
Chair, Vice Chairs, Committee members, happy meeting for the Department of Taxation. We stand on our written testimony with comments.
Okay. Thank you. Thank you for your comments. Next up, Department of Human Services.
Vice Chairs, we stand on our written testimony and support, and would also note, similar to the House bill that we concur and agree with the suggested amendments of the Healthcare Association of Hawaii. Thank you.
Thank you, Doctor. Okay, Kaiser Permanente.
Support.
Why would I think otherwise, Jonathan? Good job. Hawaii Primary Care Association, also in support. Hawaii Pacific Health.
In support.
Thank you, Michael. Queens Health System.
Strong support, Chair.
Thanks, JC. Mahalo. Will Caron, as an individual, provided testimony in support, and Healthcare Association of Hawaii.
Dr. Rachel, standing in strong support, noting our suggested amendments meant to provide clarity that are non-substantive in nature. Thank you.
Thank you. And Hilton, I do note that, again, DHS Benquest Division agrees with your amendments, so as long as there's, we should easily get them in. That's all the testifiers I have for 1369. Did I miss anyone? Anyone here, present, or on Zoom wishing to testify on 1369? Okay, if not, members, are there any questions? No questions? Okay, thank you, members. We're going to move on to the next bill on the agenda. 1366, Department of Human Services.
Good morning, Chairs Mizuno and Bellotti, Vice Chairs Takenouchi and Amato, and members. My name is Scott Morishige again, Administrator for the Benefit Employment and Support Services Division on behalf of DHS and our Director, Kathy Betts. DHS appreciates the intent of this measure, and we offer comments. We note that there are private organizations that currently offer this service. In addition, we have some concern that establishing a formal state-funded program may have the unintended consequence of incentivizing people to come to Hawaii with the expectation of a return ticket back to their point of origin. And finally, if this measure proceeds, we just ask that any appropriation in this measure not replace or adversely impact priorities identified in the executive budget or any forthcoming governor's messages. Thank you again for the opportunity to testify, and if you have any questions, I'm available. Thank you.
Okay, thank you very much, Scott. Is there anyone else wishing to testify on 1366? 1366, okay. Members, any questions? No questions? Yes, on Zoom?
Yes, I'm Zoom.
Oh, Mayor Mufi Hanneman. Yes, sir, you're on.
Thank you very much, Chair Mizuno and Chair Bellotti, and members of the respective committees of Human Services and Health and Homelessness. I submitted testimony in support of this measure. This is a second go-round for the Hawaii Lodging and Tourism Association to advocate for a compassionate way of dealing with repatriation. We believe it can be an effective tool because there are so many challenges facing the community, government, the nonprofits, and all of us in terms of how we come to grips with this issue. And in 2020, we came before you because there was an opportunity to basically advocate for matching funds because we in fact had been doing repatriation in dealing with Institute for Human Services on Oahu, Maui Family Life Center on Maui, and Kauai Economic Opportunity, where we provided funding for repatriation of individuals who, first of all, express a desire to go back. Secondly, we would connect them with a family person or a loved one that would receive them on the other end. And then we would extract a pledge from them that they would not return, that they would in fact stay from whence they came. And that program worked very well. In fact, we were able to track over a 5-year period of the people that we were able to send back through this repatriation program. There was a total of 744. Only 16 people returned, less than 2%. Less than 2% came back. So we beg to differ respectfully with the Department of Human Services on this issue here. We really believe that this will not take away or diminish from all the other efforts that we're doing to help our homeless population, be it housing, be it dealing with medical and health services, be it getting them to a better place in our community. We really believe that government provides funding. You will incentivize these nonprofit groups, because our position is that we don't get involved in how to deal with the homeless and sending them back. Give it to those nonprofit groups that care for them, that treat them, and that have a way to connect with their families. We merely provide the funding, but then if you're able to do that, I think this will be a way for them to kind of kickstart this effort again. So I commend you, Chair Mizuno, for bringing this back to the forefront again for a discussion, and would ask that you could seriously consider providing funding for a compassionate way of dealing with repatriation.
Thank you. Mufi, hang on. We've probably got some questions for you, but I want to see if there's anyone else out there, either present or on Zoom, wishing to testify on the bill before us. If not, members, questions to Mayor Hanneman? Okay, Mufi, I have a question. Mizuno.
Yes.
Yes, I remember that briefing back in 2020. For that 5-year period, you confirmed that 744 homeless will return to their home state with their families, but only 16 return. That's less than 2%. So that would indicate that DHS doesn't have this information or missed it.
We reported that information back then. It was also in news articles, so it's been documented, and we were able to demonstrate that of that 744, 646 people were sent from Oahu, 30 people from Kauai, 68 people from Maui, and it was all through those 3 nonprofit groups that we provided grants to basically implement this repatriation program, and that was the number.
Yes,
that we were.
I remember you on the news. I believe Governor Green at the time was senator. He was also on the news, and your comments were great. I think you said the proof is in the poi, with less than 2% of all homeless return to home, their home state and their home and their family. Only less than 2% actually came back to Hawaii. You did say something else that I think is very important for our committee to consider. That's funding. Now, would you suggest a public-private partnership where the state puts maybe, I don't know, $25,000 and a nonprofit or business matches that fund? What are your thoughts on that?
We're prepared to do that again. At that time, we were funding at 100%. And what we were asking for at that time is let's go 50-50. I mean, I think you put the state ultimately approve $1 million, but it wasn't for repatriation only. It was for dealing with homelessness across the board. So there were other aspects of that funding. We said let's do a 50-50. So if in fact that's your wish, we're prepared to step up again, because the funding comes from our charity walk, fundraising that's done once a year that we set aside fund, and this is one of our pillars, is to address this. So I really believe that if government participates again, we'll have more nonprofit groups that will probably want to participate in this endeavor, because they're on the front lines. They know how to treat and handle and connect homeless individuals with their families. And I think that's important. It's not going to provide passage for someone. They have to want to go back. They have to want to be able to connect with their families. So I would say that if you're going to do that, that maybe you have some clarifying language here. It makes it clear what the process is going to be like based on the experience that we've had with IHS on Oahu, Maui Family Life Center on Maui, and Kauai Economic Opportunity. That they connect with the family, that someone on the other end will be receiving them. So they're just not going back and they're exporting the problem back to their home state. And then thirdly, they did it in various ways in extracting a commitment not to return. I believe in the case of KEO on Maui, they actually had them sign something to the effect that they would not return, that this was a one-time only.
Yes, we have that in the bill. We have that in the bill. So Mayor, I'm looking, if we're moving this bill out, I'm going to recommend a public-private partnership. I'm going to blank out the amount because we don't know exactly what the amount is. If it ever starts to get legs and moves, then we'll start to figure out how much money we need. But just to be safe, I think I want to just keep the money just for this return to home program and not spread it out. I want to get proof of concept. You know it works, I know it works, but I want to make sure Governor Green and Department of Human Services they will feel comfortable that this will work. If it does, then I think moving forward we can even add to this. So that's my thoughts. Are you okay with that, Mayor?
Yeah, I mean, we're willing to step up again. We did it before. We'll do it again. And that's the way of demonstrating that we believe this program works. And I would also make sure that, it's not be put solely on the shoulders of the Hawaii Lodging and Tourism Association to do this, because homelessness is all of our problems and all of our challenges, and it behooves all of us to provide solutions to it. So yes, I think it should be open to all private sector entities to provide matching funds if in fact you want to move forward on this.
Thanks, Mayor. And this unique program, it differs from the New York, it's called the SOTA, S-O-T-A program, where they would simply find homeless and get them a one-way ticket anywhere in the U.S. out of New York. This is clearly different. It's targeted. We connect with the families. They sign an agreement saying they're not going to come back. That's why I believe your success rate is so high in the program that you've sent back 744 with only 16 returning. So look forward to working with you, Mayor Hanneman. Thank you for your comments. Members, are there any other questions for Mayor? No questions? Oh, Bert Kobayashi has a question. No question? No. Oh, okay. Mufi Hanneman, Mayor, we want to thank you for being here via Zoom. Thank you very much for your testimony. We look forward to working with you, sir.
Really think about this as measure as the 3 C's. It's connecting, it's compassionate, and it's caring.
Thank you,
Thank
Mayor.
you.
If I do a speech, I'm going to have you write my speeches for me. Okay, Mayor Mufi Hanneman, thank you, thank you. Anyone else, any other questions, members, on the bill before us? That is 1366. If there's no further questions, thank you, members, thank you, Mayor. We're going to move on to 1367. First up, Department of Human Services.
It's about the chiefs.
It's chiefs.
We would request and ask for support of the governor's message and the governor's administrative budget, in which this appropriation is also reflected. Thank you so much.
Okay, thank you very much, Dr. Moore Peterson. Next, we've got University of Hawaii. Provided testimony in support. Hawaii Pacific Health. Thank you, Michael. Hawaii Substance Abuse Coalition. Provided testimony in support. Dr. Smith Family Medicine. Testimony in support. AARP Hawaii.
Good morning.
Good morning.
Hi, this is Audrey Suga Nakagawa from AARP. I'm the Advocacy Director, and AARP stands in support of this measure. We really appreciate the fact that the federal and state governments really should ensure that Medicaid reimbursement is sufficient to address access to the full range of medical services in all settings for many kapuna and other adults and children in need of medical care. Medicaid becomes their safety net coverage if they're low income and or have limited resources. Hawaii is currently facing a shortage of healthcare workers, so we need to attract and retain and compensate them properly so that they can continue to care for our most vulnerable population. Thank you for this opportunity to support this measure.
Thank you very much. Next up, we've got Hawaii Association of Health Plans. Testimony in support, American Physical Therapy Association, Hawaii chapter. Testimony in support, HMSA. Thank you very much. Next up, the Queen's Health System.
Stand in strong support, chairs. Thank you.
Thanks, JC. Thank you. ACOG Hawaii section. Testimony in support, Hawaii Medical Association. Testimony in support, Hawaii Association of Professional Nurses.
Hi there, chairs. My name is Bradley Kuo. I am the legislative coordinator for the Hawaii Association of Professional Nurses. We stand in strong support of this measure. If there's any way to ensure that this measure requires equal reimbursement for equal work, that would be helpful. I did write something similar in our testimony, and I welcome any questions.
Thank you. Thank you very much. Next up, we've got the United Caregivers of Hawaii. Testimony in support. American Medical Response. AMR twice. Testimony in support. Kauai Community Health Alliance. Testimony in support. Healthcare Association of Hawaii.
Thank you, chairs, vice chairs, and members of the committee for the opportunity to provide strong support for HB 1367. My name is Hilton Rathel. I'm President and CEO of the Healthcare Association of Hawaii. We've struggled to address in any meaningful way health disparities that have existed in our communities for decades, disparities that disproportionately impact Native Hawaiians and Pacific Islanders. The reality is that current low Medicaid rates for professionals in Hawaii create a barrier to access for Medicaid recipients. A lack of access to timely local care has a negative impact on health outcomes, which continues to perpetuate health inequities. MedQuest has calculated that $30 million of state funds, along with the matching federal funds, will eliminate the gap between Medicaid and Medicare reimbursement for all professional services. In addition to reducing access barriers to healthcare, this funding will also strengthen and support our initiatives to both recruit and retain an adequate healthcare workforce. Thank you for the opportunity to testify.
Thank you, Hilton. Next, I've got AFA of Hawaii, Maribel Tan. President Tan, are you on Zoom?
Good morning, Rep. Mizuno, and good morning, everyone. We stand on our testimony, and we strongly support the bill. And thank you for the opportunity to testify. Thank you.
Thank you, President Tan. Appreciate it. Next, we've got Hawaii Provider Shortage Crisis Task Force. That group provided testimony in support. I've got 9 individuals all providing testimony in support. I've got 1 individual that provided comments. If I've missed anyone, if anyone's here either in present or on Zoom wishing to testify on House Bill 1367, please come on up and identify yourself.
I just want to recognize that we have submitted testimony except for nurses who want to record that we have testimony in support.
Okay, I'm sorry, the organization again?
Hawaii State Center for Nursing.
Got it. Please, if we didn't get that testimony, if you can just hand it off to our staff. Oh, okay. Must have missed it. Jonathan Ching?
Chair Bellotti, Chair Mizuno, thank you. Jonathan Ching for Kaiser Permanente. I believe we submitted written testimony and support. If not, we'd be really happy to submit that. I just want to add one comment. I just want to really thank the legislature and the chairs for hearing this bill. I know that both of you and the committees are both well aware of the acute crisis and shortage of healthcare providers we've had. At the same time, with the pandemic, we've seen large increases in our Medicaid population. And so just really want to, say thank you to the legislature for hearing this bill and to acknowledge that the governor, this is a priority. From our perspective, this is something that will immediately help alleviate the difficulties that providers and patients face in delivering and accessing healthcare. I know this is just one measure, that the your committees are both considering and contemplating to just really help address both the shortage of healthcare providers we have here in Hawaii at the same time of ensuring access to our population, especially those on the neighbor islands. So if the committee clerks don't have it, we can resubmit, but just wanted to stand in support with a few additional comments. Thank you.
They may have. Maybe I just missed you, John. Thank you. Yes.
Good morning. Paul Arsena here for Aloha Care. We also submitted our testimony, but we'll submit it again. Joining the choir and supporting this measure, we thank you very much for hearing it this morning. Increasing the rates for Medicaid providers is really a meaningful way to recognize and reward the providers that serve the Medicaid population, and we thank you very much for the
Right, Paula,
opportunity to
just in
testify.
case, if you could submit another.
Yeah, I've got a written copy here I can hand over.
Thank you. Appreciate it. Okay, anyone else wishing to testify? House Bill 1367, either here or on Zoom. Okay, if not, members, questions? Yes, Chair Bellotti.
I don't know who the appropriate person is, but I think this is a very critical bill to be moving. And if someone could help me just paint a picture of who are the providers that are going to be seeing increased rates. I noticed in the DHS testimony that we are one of the few states that provide 100% Medicare for primary care services. So who are we talking about? Who are we going to be providing this for?
Thank you for that opportunity to respond to these questions. We recognize that it's difficult because when we use terms like, medical professional, we all know what we're talking about, but it's much more challenging when you're actually trying to describe it in a bill. And I'd also like to note that if we do pass this bill and we do this investment, we would be the first in the country to have Medicaid be paying all these services at the medical professional or at the 100% Medicare level. So it does include, it's primarily physicians and other doctors, and you might be going, what, physicians, doctors, they're not the same. No, they're not the same. There's different kinds of doctors, and so it would be various different doctors. It's actually almost easier to explain what it's not. So it's not institutional care, it's not hospitals, it's not home and community-based services. Many therapies, rehab therapies, they're not included. It's not those particular professional services. So I hope that's helpful. It may not be, but I hope that gives you some ideas. Primarily doctors visits, physician services, et cetera.
So we know that physician services serving rural communities rely on teams. So does this include APRNs? Does it include mental health specialists that might be serving the Medicaid population? Is it those kinds of individuals who are part of teams of physician practices?
It usually is not the whole team, but when it comes to APRNs, as an example, their rates would be impacted because their rates are tied to the physician rates, and in Medicare, they're set at a percentage of the physician rates, and that's how it's set up in our for Medicaid as well. So they're by association, if this passes, then the APRN rates would also go up.
Okay. What about pharmacists? And I saw testimony here from ambulance services. No.
Not that we're aware of. Those are considered emergency services, different kinds of services. That's why it was a bit challenging to write the bill, to write the testimony.
Thank you.
Thank you. We've got Representative Kobayashi with a question.
Can this bill be amended to include reimbursement to hospitals, nursing facilities, whatever?
Given the title of professional Medicaid services, no, it could not.
If the title were not there, could the expansion be made?
You could, but I would note that you just heard two bills that do include funds to help hospitals and nursing facilities. You heard House Bill 1368 and House Bill 1369.
I'm sorry, but
we already use funds
yes.
to help increase payments and reimbursements to both hospitals and nursing facilities. Of course, you would want to talk with those associations.
But
I do want to note also, it does include, as an example, many hospitals and healthcare systems, they actually employ many different medical professionals. This would cover the professional costs for performing surgeries, as an example, or within the hospital setting. So it's just that it's not the hospital fees themselves, which have a different methodology and a different payment methodology.
I'm sorry. The sustainability programs, in my thinking, are different from these increases. So could we increase both?
You can give the hospitals and nursing facilities more general funds. I am just merely noting that the hospital sustainability program already does
Yes, of course.
include money to help get the hospitals up to the equivalent of 100% Medicare. That's probably not what they're netting. And then the nursing facilities, since Medicare does not pay for long-term care, there's no Medicare equivalent. But you can give more money to nursing facilities too. And I'm positive that the Healthcare Association would be willing to talk about that.
Can we increase the percentage amount to more than 100%?
Yes. We
would
have to get CMS approval of those changes. And they usually like to know why. I'm sure we could come up with a rationale, but while there'd be usually they don't ask any questions if you're comparing to Medicare and you're going up to Medicare.
Okay. So
they do ask
what
questions
would be
when you
the
go
difference
over. Pardon me?
What would be the difference between reimbursement between Medicaid, Medicare, and say HMSA?
For what kinds of services?
For so-called professional care.
Professional services? We have a question into our actuaries right now. It's surprisingly difficult to get, and so I'd have to get back to you on that because I do not have a response today.
So could we raise the percentage amount to be equivalent to HMSA reimbursement?
You could if you wanted to invest more money. I do not have that figure today.
And if we did, would we still get similar federal match?
I would be unable to answer that because CMS tends to ask lots of questions when you go above Medicare, especially if you're going up to the equivalent of commercial. They usually are not, they're not as is in favor of that. They look at Medicare as being the sort of like the standard of cost and the efficiency and effectiveness of paying for things. So when you go above that, it's much less likely, unless it was for targeted services that you're having really difficult time in recruiting or paying for, or there's a really high proportion of Medicaid enrollees. So as an example, recently New Mexico did a rate study because I think it's something like 80% of all their births and all their care are in Medicaid for, so they recently did a rate study in which they did recommend that it go up to like something like 140% of Medicare for that reason, but it was for very targeted services. So in that case, we would be more likely to be able to get CMS approval, but across the board, we would not be able to guarantee that we could get a federal match.
Okay, thank you.
Thank you. Further questions, members? Okay, if not, Dr. Judy Moore Peterson, thank you so much. Members, we're going to move on to the next bill on the agenda. That would be 1341, House Bill 1341. First up, Department of Human Services, please. Dr. I
was going to come up here. Judy Moore Peterson, MedCrest Administrator, on behalf of the Department of Services, we support the intent of this measure. We would ask that it not replace the governor's priorities in their budget. And I would also add on that speaking of increasing payment rates, this is targeted at increasing reimbursement rates for home and community-based services providers, which would not have been included in any of the prior bills.
Okay, thank you very much. Next up, ILWU, Local 1000. Provided testimony in support, I have ILWU International.
Good morning, Chair and members of the committee. I'm Susan Kinabo, and I'm representing the ILW Local 1000. I strongly support 1341, and I stand by with my written testimony submitted.
Okay, thank you very much. Hawaii Substance Abuse Coalition, testimony in support. AARP Hawaii, testimony in support.
Good morning, Representative.
Good morning. AARP, I
Chairman.
apologize.
Hi, this is Audrey, again from AARP. We stand in strong support of this measure. Most people prefer to age in their homes or in a home and community-based setting that's been provided by our over 1,600 foster family and adult residential care homes. We have scores of adult daycare providers, as well as in-home personal care assistants. And, that really helps people to age in their homes, and which is what is preferred by most people, including the Kapuna. And so we appreciate this bill that will help compensate for their services, because we need to keep them. They are the backbone of our long-term care system, and we want to make sure that they're able to continue to provide the good work that they do for our community. Thank you.
Thank you very much. I believe I already called Big Island Adult Foster Home Operators. If not, is Cora Cariaga there? Don't see her. Okay, United Caregivers of Hawaii. Provided testimony support. I apologize. Cariaga provided testimony in support. AFA of Hawaii, AFHA, AFA. Provided testimony.
Good morning.
Oh, good morning.
I'm here to support HB 222, petition for increase in Medicaid home and community-based service.
Okay, thank you very much. I believe it's coming up, but I would anticipate you guys would support this bill too. Thank you. I've got, oh yes, Maribel Tan, President Tan, on Zoom.
Good morning again, Representative Mizuno.
Good morning.
I'm speaking in collation with the other presidents and CCFFH organizations representing nearly 85% of the community caregivers in our industry. We support HB 1341. However, we feel that HB 222, thus HD1, is better written as it lists each community-based care home defined under Hawaii revised statutes to secure a permanent pay increase. For that reason, we request that you pass HB 222 HD1 and hold on HB 1341. Thank you again for the opportunity to
Thank you,
testify.
President. Thank you, President. Next, I've got eight individuals that testified, that provided testimony and support. If you are here in person or on Zoom, please state your name and feel free to give us your testimony orally.
Good morning, members and committee members. My name is Kylie Swan. I'm in support of this House Bill 1341 because I'm part of a Medicaid waiver program. If you can pass this bill, that would be great. And my caregiver needs help. Please don't be shy. If you have any questions, please let me know. Thank you.
Thank you, Kylie. Thank you. Anyone else wishing to testify on House Bill 1341?
Good morning, Chair, Vice Chair. My name is Wilfred Chang. I'm a representative for the ILW International. We stand in strong support. Thank you, Chair, Vice Chair Volati, for your comments on the previous bill. All we're looking for is to be included. We've gone the longest without any type of increase, and all we're looking for is respect. So this is the medium that we choose, and we're going to continue to fight, and thank you for your support. Thank you.
Okay, thank you. Anyone else wishing to testify on 1341? Yes. Come on up.
Good morning, Chair Albalati and Mizuno. Thank you for this opportunity to speak, committee members. Speaking on this bill, we would just like to specifically add the ARCH and eARCH and DD-DOM home operators to be specifically listed in the bill. My written testimony also reflects that fact. Thank you very much.
Okay. Matthew, could you give us your name for the record?
Matthew Yamamoto. I'm also a rep for the ILWU.
Okay, so I had you down as an individual, and for Wilford, I did call ILWU International, but maybe you didn't hear me, but I got you here too. Okay, yeah, we got you.
Okay, thank you.
Thank you so much, thanks. Okay, anyone else wishing to testify, come on up.
Good morning, Chair Mizuno and Chair Valade and members of the committee. My name is Juanita Ulep, a Type 1 ARCH caregiver for 38 years for Medicaid patients. I'm here to support the bill. Thank you.
Okay, thank you, Juanita. For some reason, your testimony may already be with ILWU Local 1000, but if not, you feel free to give us testimony so we can put it in the record. Okay, thank you. Okay. Am I missing anyone who would like to testify on House Bill 1341, either here or on Zoom? Okay, seeing none, members, questions? Okay, thank you. If there's no questions, we're going to move on to the next bill on the agenda, 1356, Department of Human Services, 1356.
Hi, good morning, Chairs. Judy Moore Peterson, MedCross Administrator. On behalf of the Department of Human Services, we stand on our written testimony offering comments. We would like to note that Medicaid does not reimburse Type 1 adult residential care homes for home and community-based services. And we believe there is some confusion with the room and board payments that are separate and not related to Medicaid. We would just like to point that out on behalf of as information for the committee. Thank you.
Thank you very much. Okay, next up, State Council on Developmental Disabilities.
We stand on our support.
Thanks, Doctor, in support. Next up, I have IOWU Local 1000, several members. Juanita, I have your testimony this time. Rosemarie, Esther. Yes, I have the three of you for IOWU 1000. Testimony all in support. Did you want to say anything else? Yeah, okay. Thank you. I got your testimony in support. Thank you very much. I've actually got, let's see, AFA of Hawaii, Maribel Tan, provided testimony in opposition. I've got Matthew, I got you here, but it's not listed as IOWU. I've got 6 individuals providing testimony, all in support. So if you'd like to testify, come on up and identify
Good morning.
yourself. Good morning.
My name is Ligaya Dugay, and I've been a caregiver for a long time. And this is the first time that I come over here to support the HB 222 petition for an increase.
I'm sorry, caregiver. We're on 1356. Yeah, 222 is later. It's a few more bills down the line.
Okay.
Yeah. But thank you. Thank you so much, though.
Thank you.
Thank you. Okay, members, to the audience again, anyone else wishing to testify on House Bill 1356? 1356, either here or on Zoom. Hi, sure.
Thank you, Chair. Matt Yamamoto again, also a rep for the ILWU. So we support this bill because there were other reimbursements made to other types of caregivers who care for and supervise Medicaid clients. So these ARCH and DD-DOM home operators also take care of Medicaid clients. So we feel they should be compensated as well, similar to the bill that was passed last year. Thank you.
Okay, thank you very much. Anyone else wishing to testify on House Bill 1356? If not, members, questions? Questions on 1356? No questions? Thank you very much. Members, going to move on to House Bill 1357 first up, Department of Human Services.
Hi, good morning, Junior Peterson, on behalf of the Department of Human Services. We are opposed to this measure.
Okay, thank you, Doctor. Next up, I've got Local 1000, IOWU. In fact, I've got 1, 2, 3. I've got several IOWU 1000 members. If you would all like to come up together, that's going to be fine. Matthew, I've got you listed as individual. I don't know if you want to come up as part of IOWU 1000 or as an individual. And I've got probably about 10 individuals providing testimony, 8 individuals, all providing testimony in support. Yes?
Hi, yes, yeah, Matt Yamamoto again, rep for the ILWU and as an individual. Thank you very much for letting me speak.
Thank you.
So these caregivers have gone without a significant raise in 14 out of 15 years. And I just, I'd ask you to just think about that for yourself. If you hadn't gotten a pay increase in 14 out of 15 years, what that's like, caring for their own families as well as all their clients, bearing the brunt of inflation for food, housing, utilities over 15 years. It might be, I'm not sure what the exact percentage increase is, but it's, in some cases it's 100%, some cases 50% increases in cost, and they haven't received a pay increase in all these years. So we'd like to see some kind of, if you want to call it retroactive pay, or if there's a better word for it, please feel free to change the title. Reimbursement or enhanced payment to these caregivers. But they're really, really hurting, and if they were to all quit, these clients would basically be on the streets. And so, look at the homeless problem that we already have. It's going to get worse. So please look into your hearts and look into the numbers and just find a way to get them some help so that this industry can continue to thrive and to service the most vulnerable in our community. Okay. Thank you.
Thank you. Anyone else wishing to testify on House Bill 1357? here or on Zoom? If not, questions, members? Okay, I have a question. I want to respect everyone here. Dr. Judy Moore Peterson and Matthew, can you please come on up? Yamamoto. We're trying to help. You're asking for a 14-year back pay since July 1, 2009. I'm having a hard time passing this bill, even if I wanted to. There's no purpose statement in the bill. Back pay is a legal term. If the focus is to recover 14 years of back pay, the plaintiffs, the caregivers here, must show cause. I don't see any cause of action. Was this concern ever brought up to the Federal Department of Labor or the State Department of Labor? I don't see that happening. Also, if it's back pay, keep in mind there's a statute of limitations generally. After 2 years, that statute of limitations bars recovery. So I don't know yet if what you're trying to get is actually legal and will apply here. Also, I have another question about criteria or standard. What if I'm the caregiver in 2009 and I retired in 2012 and then I died? Does my estate get the back pay? How do you know that I was actually a caregiver for that time unless someone in my family reaches out and says, hey, wait, we should get some for uncle? So there is no criteria, there is no standard to be followed for, in this case, the caregivers, the plaintiffs. If we were to pass something of this magnitude, we'd probably have to adopt rules regarding back pay or retroactive pay. And finally, if we were to try to fund this at $2,500 per person, this may be well over $20, $30, $40 million. If we do that, my concern is that we may jeopardize the permanent pay raise increase that we're trying to get for all community caregivers this year. So let me turn to Dr. Judy Moore Peterson first, and then I'll go to you, Matthew. So Dr. Peterson, is there any way to try to figure out $2,500 since July 1, 2009, all the way up to, and it's kind of odd because the back pay date goes into the future, June 2023. We're not there yet, so.
Yeah, we would not be able to determine, because we don't know, going back that far, we don't have records, that would go back, all the way back to that point. So it would be an estimate as to how much it would be. I think as we included in our testimony, we also pointed out that, just putting aside the word back pay, and if you didn't call it back pay and you just said, hey, we don't think you've been paid enough, here's some money, we would not be able to get any federal match for it. It would be all straight general fund. So we can try to come up with an estimate, but it would be very imprecise.
So, and Dr. Moore Peterson, I got a very specific question. For Medicaid funding, the state, it's smart to rely on not only state general funds, but to pull down the Medicaid matching funds. In this case, if I'm hearing you right, if we were to try to implement back pay, whether it be 20 million or 50 million, we can't get a single penny from federal Medicaid match?
No, that would not be a matchable service.
So Dr. Judy Moore Peterson, hypothetically, just say it's 30 million that we're trying to get for caregivers, 14 years back pay since July 1, 2009. That 20 or 30 million would be purely state general funds, zero federal funds.
That's correct.
Will that jeopardize the permanent pay increase we're trying to get all community caregivers and doctors and nurses in the bills that we have before us?
The other, as an example, the House Bill 1341, which fully funds the rate study that we did, that said, here's the amount of money that you would need in order to fund home and community-based services providers, both care home providers as well as in-home services, et cetera. That is about $30 million general funds, plus about $43 million of federal funds, so a total of $73 million. The Medicaid, sorry, I can't remember the title of the bill, the medical professional services, that one is also approximately $30 million. It's a
Pulling down
oddity.
43.
Coincidental 30, pulling down 43, or
federal.
43, so it would be a total of about 73 million. That would be funding that as well. I think if to pay something retroactive, it would just be, adding on to that. And I do not know what the appetite would be of the legislators, the finance committees, et cetera, to be able to pay additional funds, especially when there would be no federal match.
Thank you, Dr. Judy Moore-Peterson. Members, any other questions for Dr. Moore-Peterson? Okay, if not, Matthew, if you can come. Okay, I'm trying to pass this bill. It has a lot of concerns and issues. It might jeopardize the permanent pay increase for all community caregivers. I want to get your feedback. What would you respectfully request our joint committees to do with this bill?
I would suggest take a creative look at it. These are proposals that we put together from our members and various caregiver groups over the last several months. So we try to couch it in the terms that we are familiar with. Now, if a back payment isn't agreeable, then I would just change the terminology. If you want to couch it in different terms, that's fine with us. But they're just seeking help, and we're here to ask for it.
So Matthew, you heard the testimony from Dr. Moore-Peterson, $73 million, 30 in state funds, state general funds, pulling down $43 million in federal Medicaid funds. That's $73 million. It's a solid amount.
Yes.
Hypothetically, if we were to pass this bill and it was to draw down maybe 20, 30, $40 million, that may jeopardize the permanent pay raise that all community caregivers are trying to secure. You understand that?
I don't see a direct correlation.
You don't see a direct correlation?
No.
So if we're taking another 30, 40, 50 million and putting it in the back pay bill, then what happens as we're trying to negotiate the money pie for community caregivers for permanent pay raise?
We can talk about it. I mean, we have to see the numbers, we have to work on the bill, we adjust the language if necessary, and then we'll see what we have.
So you think it's fair to say that the community caregivers should get 14 years of back pay, plus we should put in another 73 million for their future pay?
That's what the request is. Now, it's up to the committee, of course, to make their decision, but that's what the request is, yes.
Okay, I don't feel comfortable about passing this bill. I will say this, I will defer decision-making till Thursday, 11:30 a.m. in this room, conference room 329, February 9th. I want to talk to the author on this bill. Matthew, can you do me a favor? Can you work with ILWU and with the members, maybe reaching out to all community caregivers? And you know what? Candor and honesty needs to be upfront. If you say, let's just go for this back pay, I'm going to be very honest. It likely will jeopardize a permanent pay increase for the caregivers. I'm calling it as I see it. And so I'm gonna wait a couple days. If you and the caregivers can get back to me Wednesday afternoon, somewhere around 3 or 4 o'clock p.m., then I will try to work with you and hopefully we can come to some agreement on something.
We'll do that. Thank you very
so
much.
So I won't kill the bill, but I need you guys to work on it. Matthew, you need to have a coming to Jesus meeting with the caregivers and be very realistic. I honestly don't think we can get two. I don't think you can get a $20, $30, $40 million back pay and also get the permanent pay raise that these caregivers are fighting for. But I ask you that you provide honesty and candor to the caregivers, and you all reach back to me by no later than 3 p.m. on Wednesday, and we can talk about the bill. So I'm giving you guys a shot. I don't know if I can rehabilitate, but I'm giving you guys a shot, best I can do.
Thank you, we appreciate that, Chair.
Okay, okay.
Thank you.
Thank you, Matthew. Any other questions, members? Okay, thank you so much, members. We are going to move to the next bill. From the back pay bill, we're going to move to House Bill 221. House Bill 221. Testifier. First up, I've got the Department of Human Services.
Chair, Dean Peterson, on behalf of the Department of Services, testifying on HB 221 HD1, we offer comments and requested clarification as to the both the population and the services being requested. Thank you.
Thank you, Dr. Moore Peterson. Next up, I've got Hawaii Family Forum. Provided testimony in support, and I have Dara Yatsuhiro providing testimony in support. Anyone else wishing to testify on House Bill 221, House Draft 1? If not, members, questions? No questions? Okay, thank you very much. Members, we're going to move on to the next bill, House Bill 223, House Draft 1, Department of Human Services.
Good morning and aloha, chairs, vice chairs, members of the committee. My name is Tim Hitchens, Social Services Division Assistant Administrator, and we house Child Welfare Services. We stand in our written testimony on this and defer to the Office of Youth Services.
Okay, thank you very much. Thank you. Office of Youth Services.
Hi, good morning, chairs. Leanne Gillespie, Executive Director for the Office of Youth Services. We stand in strong support of this bill. This measure is similar to HB 1067 and SB 1367 administrative measures. This makes changes to Act 130, which was passed last session, which authorizes the Office of Youth Services to establish safe spaces for youth across the state. In our planning phase of implementation of Act 130, we had identified several gaps. This act serves youth ages 14 to 24 and only homeless youth. The language in this measure actually expands the population of youth that can receive services. There are many youth other than those that are just homeless that are struggling with all sorts of crisis issues, whether it's food and housing insecurity, trafficking, substance abuse, mental health issues, and we do want this Safe Spaces program to also serve those youth. Additionally, this adds language to ensure that youth under this program and providers of homeless services ensure that these youth access needed services as in accordance with the Runaway and Youth Homeless Service Act. So thank you very much for allowing me to provide testimony.
Thank you. Thank you for your testimony.
Be available
Appreciate
for
it.
questions.
Okay, thank you very much. Next up, Hawaii Youth Services Network. Judith Clark. Provided testimony in support. Okay, is there anyone else, that seems to be the entire list, is there anyone else wishing to testify on House Bill 223, House Draft 1? Seeing none, members, questions on this measure? We're good? Okay. Thank you very much to the testifiers. We're going to move on to the last bill on the agenda. So it'll be House Bill 222, House Draft 1. Department of Human Services.
Good morning again. Chairs, Judy Moore Peterson, MedQuest Administrator on behalf of the Department of Human Services. We appreciate the intent of this measure. We do suggest amendments. And then we would note that it is substantively similar to another measure in which we conferred with Representative Hashimoto's office, House Bill 1438. And then the final thing we would note is that the intent of the appropriation is unclear, and that if the intent is to increase services or increase the reimbursement rates for home and community-based services, then House Bill 1341 clearly articulates the purpose and the need. Thank you.
Thank you very much. Next up, we've got AARP Hawaii.
Good morning. This is Audrey from AARP. We stand on our testimony and support. Thank you very much.
Thank you. And next, we've got Adult Foster Home Care Association of Hawaii, AFA.
Good morning again, Rep. Mizuno, Vice Chair Bilate, and all the members of the committees. I am Maribel Tan. I'm the president of the Adult Foster Home Care Association of Hawaii. I have about 1,000 members, and we strongly support HB 222 HD1, which adjusts the method by which the Department of Human Services shall calculate payments to providers of medical care and long-term supports and services. Community care foster family homes, which supplies over about 2,000 beds statewide to elderly and disabled Hawaii residents, have not seen any increase in reimbursement for over 14 years. We borne the brunt of inflation and other cost increases. 14 years, we are at loss for words. We applaud the state for commissioning the Home and Community-Based Services Rate Study Report by Milliman last year. Finally, someone has validated that we have been saying for the last 14 years. For years, it's as if no one has taken us seriously, taking us for granted. Finally, someone is recognizing our plight as an industry and the challenges we face. Based on the Milliman report, the Department of Human Services, MedQuest Division, concluded it is also important to focus on HCBS providers who serve groups with high utilization of services and who have gone the longest without a rate upgrade, such as case management agencies, community care foster family homes, and adult day health and daycare centers. Ironically, the recognition of our hardship comes from an outside consultant from out of state. Perhaps a broader national perspective accentuates how far behind CCFFAs lag behind and how we are undervalued. We emphatically join MedQuest in their observation that it is time to revise how providers of long-term care are reimbursed to better meet current and future needs. Now is the time. We were already the lowest paid in the nation, below even the low end of the spectrum according to Milliman. Inflation, which spiraled out of control, has exacerbated the challenges. Our industry is one in which the younger generation in our country have little interest. Rarely does a young person today have ambitions to become a CCFFA or to open a care home. We need to set a solid foundation for the future. With our aging population and as patient preferences have shifted away from institutional settings to home and community-based settings, this is an issue that will potentially lead to a crisis in the future. We implore you to support this measure for the future of Hawaii. Please, we beg you to please support HB 222 HD1. And I'm also in coalition with all other four associations for the CCFFAs, which strongly support this bill also. I thank you very much for the opportunity.
Thank you, President Tan. Okay, I've got a number of testifiers. Another group that comes to mind, listed several, maybe 4 or 5 times, Adult Foster Home Association. If you all would like to come up as a group, that would be fine. All providing testimony in support, either in person or on Zoom. Come on up, come on up. Yeah. Thank you for coming to the Capitol.
We strongly support HB 222, that's HD1, to raise our pay reimbursement increase.
Right.
Good morning, everyone. Garcia. This is Norma Carino. I've been a foster home operator for 33 years, but getting paid for $41.16 per day. How can we live like that? Per day. That's why I came to support the HB 222. And thank you very much.
Good morning. My name is Ligaya Dugay. I'm a caregiver for 19 years, and I'm come here to support HB 222, the petition for increase medical home and community-based service pay. Can I say something?
Yes, of course.
Okay. Our client come to our foster home with underlying medical, physical, mental, and emotional problem. We embrace them and work hard to meet their needs. Because of our client condition, we caregiver are monitoring them. If they are sick, bring them to ER. Communicate with the doctor, communicate with their families, communicate with case management and also their families. In addition, we hire our secondary caregiver for 6 hours at least or more than that. For the rate of $15 on an hour to cover for us to bring our client to their doctor or to their activities. If we calculate the expenses and how much we getting, it's not even enough, especially if we are sick and we need a secondary caregiver to cover us because we cannot work. So we pay them $15 an hour. Really, it's not enough. And pay increase will definitely be a great incentive to provide more quality service and making our home for our clients' home away from their own home. Thank you so much.
Okay, thank you. Thank you very much. Again, anyone else? Oh, please come on up and testify, please.
Good morning. I'm Noralyn Cansana. I support the HB 222 HD1, raising for reimbursement rate. Due to the increasing cost of living in Hawaii, had been very challenging for anyone to survive without any compensation, adequately compensation. Maintaining foster care home more than 23 years, I often struggle to meet financial responsibilities. I receive $44.16 per day. Client to every services, I perform for 24 hours a day, which breaks to $1.84 an hour. The care that I deliver is strenuous but very rewarding. I hate to close my business because the government will not match our pay. Supposed to be paid for the elderly, for caring elderly. Moreover, I need assistance for one of my clients who is incoherent, and I need a second person to assist me, but I pay $15 an hour. The one I get for $44.16 not even enough. That's all.
Okay, thank you. Yes, hi.
My name is Jolly Orozco. I've been a caregiver for 19 years, and $44.16 a day is not improper compensation for the hours that we put in, and the lack of raises also does not follow industry trends to rise the inflation. Over the 14 years, most other industries, along with the minimum wage in Hawaii, have increased to follow the inflation. So the lack of raises in our profession has made it difficult to keep in the cost of living in Hawaii, which makes it hard for us to stay in this profession. So I have a vacant beds and 2 beds. is available, but I'm thinking of getting paid $41 a day. It's not worth it. With the inflation in Hawaii right now, it's not worth it to do this kind of professional job. Thank you.
Thanks, Jolly.
Good morning, ladies and gentlemen. I am Flordelisa Braga. I have been a caregiver since 2009 and a foster home operator since 2016. Prior to these days, we don't even have the need to pay $500 so to be able to get a Medicaid client. For what? For them to come unannounced and check on us. And then we don't need to pay $100 to renew our license. And then this year, it's even raised up. We complied with no question. But the raise that we are trying to get, we need to go through feasibility study. Okay, that's given, it's your maybe standard operation procedure. So, as my colleague said, everything has went up, commodities and all other kinds of services, but our pay never moved, and it's the lowest to the lowest kind. Maybe you can tell, why don't you just close and get into another business? We can do that. Why not? But we're thinking of our kupunas. There are things that we can only do that you cannot do, probably. But this maybe is our calling, and we love what we are doing. So we take care of our kupunas in any state of health that they are at. And as I said, this is one thing that we can do for the state of Hawaii. And we beg your help and help us to your utmost power to, that's the thing that you only can do for us to make our way of living a little bit better. Because we also sacrifice a lot of things in taking care of these kupunas. We are already deprived of many times of family outings because we cannot get a secondary caregiver to stay behind with our kupunas. And as we get, if ever we have, we are going to pay them more than what we are getting paid. So, with your help, we wish to have this pay increase for all the caregivers in Hawaii who are taking good care of our kupunas. Thank you.
Okay, thank you. Thank you very much. Anyone else present or on Zoom wishing to testify on House Bill 222, House Draft 1? Okay, seeing none. Members, questions? No questions? Oh, yes, Representative Kobayashi.
For Department of Human Services, are the people involved in this bill identical to the ones that would be getting pay increases in HB 1341?
I don't know precisely because it is not identified in House Bill 222 as to what the appropriation or the providers, it's not as clear as to who would be covered. If it is for presuming that the caregivers, et cetera, who've just come up and testified in support of House Bill 222, then yes, they for sure are covered under House Bill 1341.
So, well, more specifically, would foster care homes be covered in HB 1341?
Yes, they are.
Yes.
Yes.
Okay, thank you.
Further questions, members? No questions? Okay. Decision making, 11:35 for the joint, and 11:30 just for human services. That's good? Okay. Okay, after conferring with my co-chair, Representative Bellotti, we're going to recess and come back for decision making for the human services calendar only, the 8:30 human services calendar only, at 11:30 for decision making, and for the joint hearing, human services and health, we will come back at 11:35 for decision making for the joint committee hearings that started at 8:45. So until then, recess. Thank you, everyone. Reconvening the 8:30 a.m. agenda. First bill for decision-making, House Bill 224, House Draft 1. Recommendations passed with the House Draft 2. Blank out the appropriation and defect the date. We're going to be defecting the dates of all these bills to June 30th, 3000. The reason we do this is a safety mechanism to make sure that the bill is following the law before we finalize. So again, this is just a procedure we use to ensure the integrity of the bill. So the effective date is June 30th, 3000. Members, questions, concerns, comments? Seeing none, Madam Vice Chair, for the vote.
Calling the vote on HB 224 HD1. The recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Representative Belatti.
Aye.
Representative Iligan.
Aye.
Representative Kobayashi.
Aye.
Representative Takanuchi.
Aye.
Representative Nishimoto.
Aye.
And Representative Garcia.
Aye.
Chair, your measure is adopted.
Thank you very much. Members, House Bill 507, I understand the intention, its intentions are pure, but if we were to pass this bill, we would be violating Title VII of the federal regulations, equal treatment for SNAP customers provision. We get nearly $1 billion in SNAP money, pure federal funding, every year, and I just cannot jeopardize that money. So although the bill is submitted and done with good intentions, I have no choice but to defer this measure indefinitely. So recommendation on 507, defer. Questions, comments, concerns? Okay, thank you very much, members. Members, next bill on the agenda, House Bill 1437. Recommendation passed with the House Draft 1. Tech amendments. Members, we're going to be deleting on page 3, lines 14 through 16, wording which actually indicates that the perpetrator may be released of criminal liability. We're going to take that out, and we're also going to delete page 5 through 6, lines 20 to page 1 on page 6. Page 5 and 6, lines 20 from page 5 to page 6, line 1. We're going to delete that. The HRS statute 712-1200 already provides adequate information that if the minor commits the offense of prostitution, they committed a violation, not a felony or a misdemeanor. Also, we're going to delete language on page 7, lines 16 through 21, and page 8, lines 1 and 2. Again, it's duplicative language. We don't need that. I don't want to confuse the next committee. And we're going to defect the date, June 30th, 3000. And if there is any appropriation section in here, blank that out. And we're going to ask in the committee report that Judiciary and Hawaiian Affairs, they're the next committee that has this, review if the fine amounts in this bill are appropriate. Okay, those are my recommendations. Questions, concerns, comments? Yes, Representative Kobayashi.
It was pointed out that the word definite, indefinite term of imprisonment was not maybe confusing.
Okay.
So I would think either you delete that word or you define that more clearly.
Again, it was delete the word definite. Rep. Kobayashi?
Yeah, whatever.
We're going to delete the word definite. That's another friendly amendment, just to make this bill reasonable. Because that would probably be considered tech amendments. So we're going to do that. Anything else, members, to add before we take the vote? Okay, if not, Madam Vice Chair, for the vote to pass with an HD1.
Voting on HB 1437, Chair recommends we pass with amendments, noting that all members are present. Chair and Vice Chair both voting aye. Any members voting with reservations? Any nays? Chair, your measure is adopted.
Thank you very much. Next bill on the agenda, House Bill 438, recommendation to pass with an HD1. Committee report, let's put in the figure of $218,556. This is for one full-time employee, a coordinator. It's also for the program and administrative costs. Put that in committee report. Also on the committee report, let's place the Office of Youth Services testimony in support of this measure, which really explains the need for this bill. We want to make sure we have the intent of this bill in the committee report. Defective date to June 30th, 3,000. If there is an appropriation amount in here, blank out the appropriation amount. But the committee report already contains the $218,000, so we're covered. Finance will understand what we're talking about. Members, questions, comments, concerns? If not, Madam Vice Chair, for the vote, please pass HD1.
HB 438, passing with amendments, Chair and Vice Chair voting aye, all members being present. Does anyone vote with reservations?
Reservations.
Noted. Any nays? Chair, your measure is adopted.
Thank you very much. We're going to go right into our joint hearing agenda. This is Human Services/Health. First up is House Bill 883. Recommendation, pass with an HD1. Defective date, June 30th, 3,000. Should there be any appropriation section in it, we are going to blank out that amount. In the committee report, DHS and Department of Health provides that DOH should have the expertise in medication-assisted treatment. Let's place that in the committee report. In addition, let's place Department of Health's testimony regarding a new opioid treatment program timeline. They're giving us a timeline how long it might take to implement this program should we pass it into law. Also, page 1, lines 10 through 11, amendment. Change Department of Human Services to Department of Health for the appropriation of funds. They're better able to handle these mobile units. I think that's it. Members, questions, concerns, comments? If not, Madam Chair, for the vote to pass an HD1 on 883.
Voting on HB 883, Chair's recommendation is to pass with amendments. Noting all members are present, are there any nays? Any with reservation? All members voting aye. Chair, your measure is adopted.
Thank you.
Health Committee, same recommendation. Go ahead, Vice Chair.
Members voting, Health Committee members voting on HB 883, Chair's recommendation is passed with amendments. Chair and Vice Chair vote aye. Representative Amato?
Aye.
Representative Iligan?
Aye.
Representative Kobayashi?
Aye.
Representative Mizuno?
Aye.
Representative Nishimoto?
Aye.
Representative Garcia?
Aye.
Chair, recommendations adopted.
Thank you. Thank you, Chair. Next measure on the joint agenda, House Bill 916. Recommendation passed with a House Draft 1. Tech amendments. Defective date, July 30th, 3,000. Blank appropriation amount. Committee report. I want to put in the testimony by Ruthie Agbayani. Last time personal needs allowance was increased was 2007 from $25 to $50. 16 later, we seek another increase from $50 to $75. If we can place that in committee report. Also, we're going to adopt the amendment suggested by Department of Human Services. Okay, members, questions, comments, concerns? We're good? Okay. Madam Vice Chair, can you take the vote for House Bill 916 HD1?
Voting on resolution number HB 916, the recommendation is to pass with amendments. Chair and Vice Chair are both voting aye. Are there any members voting nay? Seeing none. Are there any members voting with reservations? Chair, your measure is adopted.
Thank you.
Health Committee members, same recommendation, HD1.
Voting on HB 916, Chair's recommendation is passed with amendments. Noting all members present, any reservations? Any noes? Chair, recommendations adopted.
Thank you, everyone. Next bill on the agenda, House Bill 1053. Recommendation passed with an HD1. Tech amendments. Defective date to July 30th, 3,000. Blank any appropriation amount. In the committee report, we're going to put Governor Green's strong testimony in support relating to access to mental health services for children birth to the age of 5. Also in the committee report, note Governor's testimony regarding the office to coordinate all mental services for youth. Right now, it's kind of buckshot, and so you see the governor's trying to consolidate, and we want to help him. So if we can put that in the committee report, so the Finance Committee will know what we're trying to do with this bill. Members, did I leave anything out? Comments, questions, concerns? If not, we're going to recommend that this be passed with an HD1. House Bill 1053. Madam Vice Chair, can you please take the vote?
Voting on HB 1053, the recommendation is that it is passed with amendments. Chair and Vice Chair voting aye. Are there any members voting nay? Any members with reservations? All members voting aye. Chair, your measure is adopted.
Health Committee, same recommendation, HD1. Voting on HB 1053, Chair's recommendation is passed with amendments, noting all members present. Any reservations? Any noes? Seeing none, Chair recommendation is adopted.
Thank you, members. House Bill 1343. I have recommended amendments. Just give me a minute to confirm with my co-chair. What do you want me to do? I mean, this is what I have, the amendments. You're good? Okay, just want to make sure. Okay, after conferring with the author of the bill, my co-chair, we're going to pass House Bill 1343 with amendments. HD1, we're going to make tech amendments. We're going to defect the date to July 30th, 3000. If there's an appropriations section, we're going to blank that out, and we're going to add the HMSO amendments to this measure. Is that good? Okay. Questions, concerns, thoughts?
Comment, Chair?
Yes, Representative Garcia.
Thank you, Chair. I just don't agree that tax dollars should be spent on the murdering of innocent life. So for those reasons, a no vote.
Okay, thank you very much. Any other comments, concerns? If not-
I will respond that this is not a bill about what the previous speaker said. This is about ensuring access to health care for women and families throughout the community. Thank you.
Thank you, Chair Bellotti. Any further comments before we take the vote? Seeing none, Madam Vice Chair, please take the vote. Pass with an HD1.
Voting on Resolution HB 1343, the recommendation is to pass with amendments. Chair and Vice Chair both voting aye, noting that Representative Garcia
No vote.
voting nay. Any other members voting with nay or with reservations? Seeing none, Chair, your measure is adopted.
Health Committee members, same recommendation, HD1 for House Bill 1343. Voting on HB 1343, Chair's recommendation is passed with amendments, noting all members present. Any reservations or noes?
No.
No vote for Rep. Garcia. All others vote aye. Chair recommendation is adopted.
Thank you, members. House Bill 1368 is next up. Recommendation passed with a House Draft 1, tech amendments, defective date June 30th, 3000, blank out the appropriations section, adopt suggested amendments by Healthcare Association of Hawaii, also DHS MedQuest tech amendments. In the committee report, they want, the proponents of this bill, DHS wants Legislative Reference Bureau to review the bill to preserve the exemptions from the special fund exemptions. So if we can note the request by the Department of Human Services, that will be in a committee report focused toward Legislative Reference Bureau. Okay. Any questions, concerns? If not, those are my recommended amendments. Madam Vice Chair, for House Bill 1368, passed with HD1, please take the vote.
Voting on HB 1368, the recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Any members voting nay? Seeing none. Any members voting with reservations? Also none. Chair, your measure is adopted.
Thank you.
Health Committee members, same recommendation, HD1. Voting on HB 1368, Chair's recommendation is passed with amendments. All members being present, any reservations or noes? Seeing none, Chair recommendation is adopted.
Thank you. Next measure, 1369, recommendation passed with an HD1, tech amendments, defective date June 30th, 3000, blank appropriation, adopt amendments by Healthcare Association of Hawaii and DHS MedQuest. Any questions, concerns? If not, Madam Vice Chair, can you please take the vote to pass with an HD1 1369?
Voting on HB 1369, the recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Any members voting nay? None. Any members with reservations? Seeing none. Chair, your measure is adopted.
Thank you.
Health Committee, same recommendation, HD1. Voting on HB 1369, Chair's recommendation is passed with amendments, noting all members present. Any reservations or noes? Seeing none, Chair recommendation is adopted.
Thank you, members. Next bill, 1366. This is the Return to Home bill. Let's pass with an HD1, tech amendments, defective date July 30th, 3000, blank the appropriation amount. DHS amendment, let's put that in there. Also matching funds for community programs. Let's make this a public-private partnership. You heard Mufi Hanneman talk about this endeavor. Also in the committee report, I want to make sure we get the words of Mayor Mufi Hanneman. The program is already successful. 744 homeless returned to home, their home states, their home families, their home relatives. Only 16 returned back to Hawaii. That's less than 2% returning. This program does work. We just need to get Department of Human Services to see the value in this. Let's focus on the science. One other thing I wanted to add, the cost for the airfare. Half the cost of the airfare shall be paid by the individual or his or her family, unless the individual is indigent and lacks the financial resources. Those are the amendments we wanted to add. Any questions, concerns, or thoughts on the return to home bill? Yes, Representative Kobayashi.
Language from the first bill of the first, language from the, first bill of the first agenda allows for contract without, what is that, chapter 103?
Yeah, 103D and
Yeah.
103F.
I mean, if this is going to be a public-private partnership, that might help.
Brilliant. Okay, guys, this is the Kobayashi Amendment. We're going to take from House Bill 224, House Draft 1, page 1, lines 7 through lines 11. Page 1, lines 7 through 11. We're going to place that into this bill because it talks about how you can have a public-private partnership. Brilliant. Thank you, Representative Kobayashi. We're adding the Kobayashi Amendment. Anything else, members? Okay, if not, Madam Vice Chair, for the return to home bill, please take the vote.
Taking the vote on HB 1366, the recommendation is to pass with amendments, noting that all members are present, none are excused. Chair and Vice Chair voting aye. Any members voting no? Seeing none. Any members with reservations? Seeing none. Chair, your measure is adopted.
Health Committee, same recommendation, HD1. Voting on HB 1366, Chair's recommendation is to pass with amendments. All members being present, any reservations or noes? Seeing none, Chair, recommendations adopted.
Thank you, members. House Bill 1367, recommendation passed with an HT1 tech amendments. The effective date, July 30th, 3000, blank appropriation. Placed in the committee report, $30 million in state funds to draw down $43 million in federal Medicaid funding. Also note that today we have 464,000 Medicaid clients in the state, nearly 1/3 of our population. I also wanted to accept the amendments by the Caregiver Coalition, led by Mary Bell Tan. And in the committee report, Chair Bellotti had identified, she wanted to identify the healthcare workers covered for Medicaid patients, which would be, as we're trying to seek equal 100% of Medicare rate, clarification by DHS. Let's put those thoughts in the committee report by my co-chair, Representative Bellotti.
Actually, we could strike that. It's in the language of the bill,
Okay.
identifying which healthcare providers are.
Okay, so we're good. We don't need.
Yes, we don't need
Okay,
that.
I'm sorry. Strike that. Think that's it, members. Any questions, concerns? If not, Madam Vice Chair, please take the vote.
Voting on HB 1367, the recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Any members voting no or with reservations? Seeing none, Chair, your measure is adopted.
Thank you.
Health Committee, same recommendation. Voting on HB 1367, Chair's recommendation is passed with amendments, noting all members present, any reservations or noes? Seeing none, Chair, recommendation is adopted.
Thank you. This is your bill. Do you want to do the?
No, you can do it.
You sure?
Yeah, yeah.
Okay. Okay, members, House Bill 1341, recommendation passed with an HD1. No tech amendments. I repeat, no tech amendments. The effective date, July 30th, 3000. Blank the appropriation amount. That's a recommendation. Questions, concerns? If not, Madam Vice Chair, please take the vote.
Voting on HB 1341, the recommendation is passed with amendments. Chair, Vice Chair voting aye. Any members voting no? Any members with reservations?
Reservations.
Duly noted. Chair, your measure is adopted.
Health Committee, same recommendation, HD1. I'm voting on HB 1341. Chair's recommendation is passed with amendments, noting all members present, any reservations or noes?
Reservations.
Reservations for Rep. Garcia. All others vote aye. Chair, recommendations adopted.
Thank you. House Bill 1356, recommendation passed with an HD1. Tech amendments, the effective date to July 30th, 3000, blank appropriation amount. Put in the committee report, concerns by DHS. Questions, concerns? If not, Madam Vice Chair, please take the vote.
Voting on HB 1356, the recommendation is passed with amendments. Chair and Vice Chair both voting aye. Any members voting nay? Any members with reservations? Chair, your measure is adopted.
Thank you. Members, House Bill 13...
Wait, Health Committee, same recommendation, HD1. Voting on HB 1356, Chair's recommendation is passed with amendments. All members present, any reservations or noes? Seeing none, Chair recommendation is adopted.
I apologize, Chair. Next measure, 1357. Members, this is a difficult bill. We're going to defer decision-making to Thursday, 11:30 a.m., room 329. That's February 9th. Defer decision-making to February 9th, 11:30 a.m. in this room, 329. Next measure, House Bill 221, House Draft 1, defer. Recommendations defer. Next measure, 223, House Draft 1. Recommendation passed with an HD1, tech amendments, defective date July 30th, 3000, blank appropriation. Committee report, intent of the bill, it's to save our youth from being homeless. Let's put some of the comments by the Office of Youth Services in the committee report to explain the intent. That should be it. Questions, concerns? If not, Madam Vice Chair, for the vote.
Voting on HB 223, the recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Are there any members with reservations or nay? Seeing none, Chair, your measure is adopted.
Thank you.
Same recommendation, Health Committee. Voting on HB 223 HD1, Chair's recommendation is passed with amendments, noting all members present, any reservations or noes? Seeing none, Chair recommendation is adopted.
Thank you, members. Last bill on the agenda, House Bill 222, House Draft 1. Recommendation passed with an HD1, tech amendments, defective date July 30th, 3000, blank appropriation. Adopt the amendments by DHS MedQuest. Adopt the amendments by Caregiver Coalition, Mary Beltan. Wanted to note for the record that we appreciate Rep. Hashimoto, Rep. Lamasao, Senator Moriwaki on working on this endeavor. Any additional comments or concerns on this bill? If not, Madam Vice Chair, for the vote.
Voting on HB 222, the recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Are there any members voting with reservations or no? Seeing none, Chair, your measure is adopted.
Oh, that's right.
We're done.
Okay, members, thank you very much. We're now adjourned.